Surgery isn't over until it's over. Zonular dialysis during cortex aspiration in a patient with no preoperative zonular dehiscence. This is a grade 2 nuclear sclerotic cataract with mild posterior subcapsular component managed by phacoemulsification under subtenon's block. Arshinov soft shell technique was employed for coating the corneal endothelium, followed by a square-shaped clear corneal wound construction with a 2.2 mm keratome. Capsular rhexis was initiated and completed, but to my liking, the rhexis was slightly smaller than anticipated, but the surgery was proceeded with nuclear rotation and sculpting in view of the soft nature of the cataract. After trenching, stop and chop technique was employed to divide the nucleus into 4 quadrants. Once the nucleus was divided into 4 quadrants, they were then emulsified. The cortex aspiration was initiated with bimanual irrigation and aspiration system. To my surprise, there was a mild zonular dialysis extending for 3 clock hours in the inferonasal quadrant noted during cortex aspiration. Intraoperative decision of proceeding with meticulous cortex aspiration from the remaining 9 clock hours was initiated with reduction in bottle height, and cortex aspiration was completed successfully. In this scenario, the zonular dialysis could have probably happened during the nucleotomy process due to the stress on the zonules owing to a small rhexis. Small rhexis may be the culprit and should be identified and enlarged to avoid zonular dialysis. Now, moving on to the next step, triamcinolone acetate staining was done to delineate the vitreous strands prolapsing through the zonular dialysis area, following which a thorough anterior vitrectomy was performed with a minimal bottle height to prevent further hydration of the vitreous. Since the zonular dialysis was present only for 3 clock hours, a capsular tension ring was chosen and was placed into the bag to stabilize it. Following which, a single-piece hydrophobic foldable IOL was safely placed into the stable bag. Pilocarpine was injected at the end of the surgery to check the mobility of the pupil. Pupil was mobile and circular with no vitreous strands in the anterior chamber, which was reconfirmed by triamcinolone acetate. In this scenario, probably the domino effect of zonular dialysis started due to a small rhexis. This is a 3-month post-op picture showing a well-centered IOL with vision of 6 parts. Take-home message: zonular dialysis can occur during cortex aspiration even after uneventful phaco in patients with no preoperative zonular dehiscence. Small rhexis may be the culprit and should be identified and enlarged to avoid ZD. Thank you.